So, welcome for the Region 1 Town Hall for Year 3. Thank you for coming. We will have a handout available. Laura, I'll be happy to send that to you by email later as well, so you have that available. But let me see if I can pull up chat and share with everyone both the handout that we have available as well as a Padlet that we will be using for this conversation here. So if you didn't want to use chat, but you're welcome to do so, or you can just download the handout that we have as well. And I'm not sure what that weird text is that came up, but anyway, so Region 1 is approximately all of these states, as well as the District of Columbia. That's not new. I will also say that the Region 1 team has not changed since last year, really, aside for our interim dean, Alexa Mayo, has been serving here for about 11 months as our interim dean. And probably next year we will have announced our new dean. So that will be a very exciting thing for everyone to meet them. As a reminder, our national initiatives are still related to confronting health misinformation, bridging the digital divide, and environmental determinants of health. And we've been doing a lot of programming tied to each of those, but you're more than welcome to check them out and see some of the things that are tied to each of those national initiatives. I will also like to invite you all to attend our Region 1 Unconference. It is scheduled on December 5th through 7th. Each day will be focused on one particular national initiative. So if you are primarily interested in environmental determinants of health and would like to meet with others interested in that theme, you are more than welcome to attend just that one day and be engaged with the others to talk about programming that you're doing and make some connections. So I encourage you to do that. It should hopefully be a nice opportunity for you to participate with others focused on a particular item of interest. And I will say, we do have some registrations already, so that's really nice. We also have our virtual symposium scheduled January 24th through the 26th. This symposium is going to highlight a lot of the programs that the NLM has sponsored since the cooperative agreement began in 2021. So we'll feature projects that were funded in years 1 and 2, and also some of the other projects that we've offered, sort of like how NCDS, the National Center for Data Services, has sponsored a program in helping LIS students build their data skills so that they can join the workforce. So do be on the lookout for when the registration for this is available. So I think it'll be a great opportunity. Regarding our regional awards program, we hope to make announcements in early 2024. The reason why we are delaying this is some of the programming that we do intend to offer in 2024 will also coincide with some of this as well. And we're trying to work out a number of those projects so that it would be a seamless opportunity for everyone in our region to benefit. But once we do make the announcement for the project awards, you can reach out to either Nancy or me, and we'll be happy to answer questions as you develop your proposal. But I will say that the proposal writing toolkit is a great resource, and it's something that you can utilize whether you're applying for an NNLM grant or just any other type of grant from any agency, in all honesty. I will also say that the NNLM has created a number of different resource guides. Aside from the proposal writing toolkit, just this past year, we've launched the Environmental Health and Justice Resource Guide. There's one on community engagement that we produced, as well as our newest one on diversity, equity, and inclusion. So I encourage you to look at those resource guides, and if you have a resource guide at your own institution, feel free to take some of the content and adapt it for your own resource guides as well. I do want to share some of the updates from the offices and centers as well. The NLM training program reaches about over 20,000 people a year. Aside from the 41 resource guides, we also offer 32 on-demand classes, and there is a regular digest that is sent out to all of the network members, alerting people of all of the upcoming classes and opportunities that we have available. If you're unable to attend any of those classes, the webinars are generally recorded and made available on our YouTube channel. And I will also say that, well, I'll mention this later, but we do also provide some of the fees tied to the MLA specializations as well. We do have some new classes that were launched this past year, including one on drug and chemical information, common data elements for standardizing data collection. Beyond the binary was also a new class that was launched this year. And then Telehealth 101 was also launched this past year. A lot of our regional training programs are also in support of the national training that is offered throughout the whole nation. So it's not only to benefit our region, but also the nation as well. And I will say that a lot of the work that we've done so far to date, we've had about 33 opportunities related to training and education, and we've reached close to 1,400 participants so far this year. And keeping in mind, our year goes from May 1 to April 30th. So we've reached a lot of people to date so far. I would like to invite you to a number of upcoming trainings as well. So on the 31st, just next week, we'll have another session on harm reduction in action. This will be the language as harm reduction. We'll also have health insurance literacy in libraries. We will later in November have the Cite NLM Fall Wikipedia Edit-a-thon. And then on the 16th, we'll have Rural Health Resources, which is, I think, timed on Rural Health Day as well. And then the following day, we'll have Holding Space to discuss a complicated past, exploring medical libraries' role in perpetuating racial science. And if you haven't noticed, this was based off of the authors of a JMLA article will do a presentation on some of their experiences with this as well. So I mentioned earlier that we will cover MLA's fees to get your specializations, either with consumer health information, the data services specialization, and also the systematic review services specialization. With the SRSS, because we don't have an online form for this, you can just email me directly and I'll be able to connect with MLA to get your specialization covered if the SRSS is something that you are hoping to get your certificate in. A lot of people don't know exactly what the NNLM Evaluation Center does, but they do a lot in terms of understanding our internal framework and helping us better assess the things that we do. So one of the things that they created over the past year is the Participant Activity Survey, which is to help with any of the regional surveys that we offer. They've also launched a membership survey nationally as well. And they've hosted things like the Data Visualization Challenge, and they've kept up to date with a number of different products. And most recently, one of their products were personas related to the organization, all of our network members, who are our users, is something that they were really studying. And they've shared this and made it publicly available through their Zenodo as well. So that's something that the NEC has been responsible for. And one of the other things that they've done is they've looked at a lot of the training evaluation data that has been shared. And On the plus side, a lot of the training opportunities based on the evaluations have really shown that it was engaging, informative, the instructors were knowledgeable. They found that it was well paced for the webinars and everything that we have offered. Additionally, we found that our participants have increased their knowledge and felt familiarity with the resources that they were exposed to, and they really gained a lot of information by attending a lot of our training classes that were available. And then they've also mentioned that there were some increases in their skills for the majority of the webinars that we've offered, from communicating health to evaluating health information, utilizing a specific resource. And for some of them, not all of their webinars are that way, but for working with data or data sets. So that I thought was really nice to see some of the results coming from the evaluation center as well. We also got an idea of what our users thought of was going to help them as a result of all the trainings that we've offered, including whether it was to apply for funding, updating some of their own resources, planning some programming on their own, or just sharing some of the knowledge with others, whether they're within their library where they work or with their users. And then we also looked at how they had taken some of this training to help with their own development. So whether it was to increase their own career opportunities, do some new tasks, or engage with audiences, it was something that was really nice to see in terms of the results with this. Overall, on a general 1 through 10 Likert scale, the majority of our participants were likely to recommend all of our trainings. So I thought that overall, this was something that I thought was really important. So I did want to share updates related to the National Library of Medicine. And this is the, in case you missed it, notices, because a lot of this information is shared on the NLM Technical Bulletin. So the first thing that they wanted me to make sure that everyone was aware of is that PubMed now offers proximity searching. And so that lets you locate terms appearing in any order, and you can find a specified maximum number of terms in between in the title abstract, and some of the affiliate fields in PubMed records. So I would recommend going and searching the NLM Technical Bulletin to see how this feature works. Clinical Trials unveiled a new modernized site this year, and it should be a little bit easier to read and to navigate. And it is also mobile friendly now too. You can learn more by taking the clinicaltrials.gov for librarians 1 hour CE. That's available on nnlm.gov as well. Within Medline Plus, there are about 60 new tester knowledge quizzes that are available. So they are considered educational and fun, and is a great way for people to to learn more about Medline Plus and to test their own knowledge. And they can be found under the health topics, under the quiz section of See, Play, and Learn. So that's another area that you can go to and get some more information and test your skills. PubMed Central now includes Spanish language journals as well. So you can learn more about the Spanish language journals that were selected for inclusion within NLM by visiting the technical bulletin. And you can participate in learning more by taking the How PubMed Works selections class to get an idea of their inclusion as well. A preview of the 2024 medical subject headings vocabulary will be available next month, November of 2023. And we'll have a mesh, it'll be available on the mesh website as well. Of particular interest this year are a new set of terms related to psychological stress. I believe that's all due to the pandemic too. Um, and then I would recommend, again, checking the NLM Technical Bulletin for the annual Mesh Highlights webinar that will introduce you to the new and changed Mesh headings for 2024. NLM has office hours every month, and it's an opportunity for everyone to meet the people who are responsible for maintaining a lot of the NLM products directly. So you'll get an idea of some of the questions that people are asking and some of the responses directly from the maintainers. And then recently this month, they covered clinicaltrials.gov, as well as the new interface for the website, protocol registration, and the reporting system as well. So do consider looking over the technical bulletin, as that's where you'll be able to find a lot of that information. Earlier this summer, it was announced that Dr. Brennan was retiring. So her last day was on September 30th. And at the moment, Dr. Lawrence Tabak is the acting director. And no, actually, I'm sorry. Stephen Sherry is the director of NCBI, and he will also be the acting NLM director until the national search takes place to find a new NLM director. If you have any questions about specific NLM resources, we recommend using the NLM Support Center link to begin. And if the answer is not available from checking that, you can submit a ticket as well. So that is something that is available for you that you can take advantage of. And then we have engagement opportunities that are available. And engagement is varying based on the individual itself. So it could be something as simple as taking a class to following us on social media. You could even write a blog post for us, and that would be greatly appreciated. We also think our network members are very knowledgeable on specific topics that interest them. So if you're interested in being a speaker, we recommend reaching out to any one of us and say that, you know, you'd really like to talk about this because you haven't seen it offered by anyone in the region yet, and you'd like to really talk about it. And it's also something that could be helpful for your CV, and it could be helpful for you if you're working on promotion and tenure as well. So that is an opportunity for you, and we will be launching and announcing, hopefully, in November, our hospital libraries program advisory group. So April and I will be working on the charter, and we hope to share that out so that hopefully we can be able to support the hospital librarians a little bit better. And for an example of our resource guides that we have up available on our website currently a speaker agreement, which talks about some of the guidelines and gives you an idea of what some of the expectations are related to doing a webinar for us. So we wanted to make sure that that was something that was a little transparent for everyone. And this is a year 4 preview of some of the things that we've been working on behind the scenes. And I wanted to give you a little update to what can you expect as well. So one of the things that we've been looking at, we've been talking with at the University of Pittsburgh, there's the Racial Equity Consciousness Institute. And they offer a program that's about 7 weeks long to help with developing racial equity consciousness. This was something through the All of Us program that they had offered, but they had primarily kept it to preferably rural public libraries. And I wanted to offer this for the region. And this is something that I've been working on to try and see if we can offer this, hopefully in year 4. But it's a great 7-week program, because I know a lot of library DEI committees might just be getting to know and understand the ideas of diversity in terms of the individual. And this part, what this will do is move into the next steps forward beyond just the getting to know you kind of thing and everyone's differences. So I think that this will be a great opportunity. And it's 7 weeks long. Sessions will be live as well, virtual live. And I think there's a lot of great possibilities with this opportunity too. We will also be working on a rural and tribal health symposium. It would be great if we can do this next November, so November of 2024, when there is a Rural Health Day. But if we can't manage to organize ourselves in time, we may offer this in early 2025. But the goal right now is to have this available in recognition of Rural Health Day in November. Another project that we are working on is the Association of Academic Health Science Libraries approached to us and talked about the need to develop more mid-level managers. So these are people who have maybe 2 or 3 years at least of experience working in their as a librarian, but are now thinking about becoming like an assistant director or associate director or assistant dean, perhaps. So this is to help with mid-level project manager development. And this is a pilot project that we're working with in hopes of developing our next set of mid-level managers. And then we have a number of different programs that we are thinking about and planning for year 4. This includes our training programs. We'll have a data community of practice that we will work with in collaboration with NCDS. We hope to offer mental health first aid as another training program. And then there may be some webinars tied to climate resilience as well. There are 2 other curriculum development programs that we are thinking about in terms of updating and or developing. The first one would be related to Project Share. And Project Share is a program that's designed to help teenagers become health ambassadors and to talk with others in their community on different health topics and issues of interest. We want to update this to more relevant topics that teens may feel are important to them. And this may include gun violence, dating violence, and other things that are relevant, that are a social determinant of health for them. And then another thing that we've been thinking about in collaborations with other regions is to develop a troop badge that the Girl Scouts could use for their curriculum as well. So Girl Scouts could get a badge for doing things that are of interest related to health and health equity that the NNLM supports as well, for example. I do want to share with you a number of different ways that you can connect with the NNLM. I will say that I have removed whatever Twitter is now called. I don't know, because we don't really post on that as regularly anymore. And plus, I think that there's going to be some more changes to Twitter down the line that makes me less open to using that service. But I will encourage you to check us out on Facebook or on LinkedIn. You can also subscribe to our newsletter or subscribe to our blog as well. And so that is our major update. And hopefully you picked up on 1 or 2 things that interested you. And then if you have any questions, Jessica has joined us, and as well as Gina. Hi. Do you have any questions for us? Okay. Well, thank you for the update. We just wanted to give a quick rundown of a lot of the things happening within the NNLM, as well as some updates to a lot of the NLM products as well. And we hope that if you have any questions, feel free to reach out to us directly. But otherwise, I think that might be it. And we made it so that Laura does not miss out on anything because she had to leave at 2:32.
Thank you so much, Tony. But I actually did have a question.
Oh,
Um,
sure. What's
I
your
believe
question?
that you announced this earlier, but you said you were going to send out the slides so like we can share it with the others at our place that unfortunately couldn't make it today.
Sure. Well, I do have a handout, so I'm going to make sure that that's available for you here. But I need to make these slides 508 compliant before I can send them out to you, Laura.
Okay.
So I'm happy to send that out. I just need probably I can't get to it till next week, I believe, to make them compliant. And then once it's done, I will make them available, but that'll be when the recording will be available. So I'll email it to you then.
Okay. Thank you.
Sure. Any other questions? Well, this was very quick. Um, well, thank you all for attending. I do appreciate that, but please reach out to us if you have any questions or if you have any comments or anything that you'd like to share. You can certainly do that in our Padlet as well. So thank you all. Yay.
Yay.